Order. Question number 2, the Honourable Annette King.
My question's to the Minister of Health. If government health expenditure has not kept up with all inflationary pressures, as he admitted 3 weeks ago, what impact has this shortfall had on patients?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, the central premise of the member's question is wrong. Inflation is currently 0.3%. Cost pressure funding for 2015-16 for health is around 0.6%. Extra investment of over $4 billion under this government is delivering free under-13 GP visits, 50,000 more operations, 60,000 more first specialist assessments and 5,500 more doctors and nurses. It's only a national government that can both handle the country's finances and deliver more services.
Supplementary question, Mr
Supplementary
Speaker.
question, the Honourable Annette
Does he
King.
stand by his statement that no data, quote, has ever been collected, end quote, on the number of patients referred back to their GP without a specialist appointment? If so, why have 17 of the 20 DHBs who have reported so far said that 146,000 people have been returned to their GP without an appointment in the last 4 years?
The Honourable Dr Jonathan Coleman.
Mr Speaker, as the member herself admitted on Radio New Zealand last Thursday, that data is partial and incomplete. The only thing we do know is that Labor was sending 65,000 people a year back from hospitals to GPs. We are the first government to ever build a complete picture of the data, and as I've said before, that data will be assembled and ready to publish next year. So that member knows that that is incomplete and not correct.
Supplementary question.
Supplementary question, the Honourable Annette King.
How many GPs, like Dr Leslie Bond from Rolleston, have contacted him since he became Minister, concerned their patients cannot get a specialist appointment even after several referrals, and their condition has deteriorated to the point where they can't drive, they can't walk, or they're now terminally ill?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, as one member in this House has said previously, it's better to help patients than to use them. That, of course, was Annette King. The only thing we do know is true that when we came into government, there were 24,000 surgical discharges in Canterbury per year. There's now well over 30,000. Sorry, that is FSAs. In terms of operations, we've lifted the number of operations in Canterbury by 52%. So actually, the answer to unmet need is to do more. Unfortunately, that member, when she was Minister of Health, did less with more money.
Order.
Supplementary question. Oh, the old dried arrangement over there.
Order. Supplementary question, the Honourable Annette King.
What was his reaction after hearing Graham Higgins' story on TV1 on Sunday night? A man who did not receive a specialist appointment in time and is now terminally ill with cancer.
Outrageous.
The Honourable Dr Jonathan Coleman.
Well, my reaction is, look, I have every sympathy for that gentleman. The reality is we don't know the details behind that case, and I think it would be good if Mrs King actually worked to help that patient rather than exploit and use him.
Supplementary question, Mr
Supplementary
Speaker.
question.
The Minister know?
Order.
Why are
I haven't called them, maybe. The Honourable
supplementary
Annette
question.
King, supplementary question.
Why are alarm bells not ringing for him about timely access to services for New Zealanders after hearing about the patient yesterday who died because their bowel cancer was not diagnosed in time, because the number of people waiting for more than 12 months for a colonoscopy in Auckland is 4 times now than it was in 2010?
That's
Honourable Dr.
absolutely-
Jonathan
That's
Coleman.
absolutely incorrect. I mean, we had done 6,000 more endoscopies and decreased the waiting time by 30%. And I just think it's outrageous that Mrs King continues to exploit people's misery to make a political point, because she actually knows we're doing 60,000 more appointments, 50,000 more operations. She doubled the budget, did 7,500 fewer appointments and 2,000 fewer operations. How could you have done so badly?
Speaker did actually. I don't think it was the Speaker.
The Honourable
No.
Annette King, supplementary.
Supplementary question. Are DHBs...
If the member wishes to answer.
Yes, I do, Mr.
Supplementary
Speaker.
question, the Honourable Anna King.
Are DHBs finding it difficult to make the cuts required this year because of the $1.7 billion missing from the health budget over the 6 years of this government? And is that why only 1 out of 20 DHBs have had their annual plan signed off by him, and it's almost September?
The Honourable Dr Jonathan Coleman.
Mr.
I have
Speaker,
those
look,
two
that is
supplementary
totally
questions.
incorrect. There's an extra $400 million went into the budget this year for health. The budget spending in health is at record levels. All we do know is that Mrs King doubled the budget and did fewer operations, fewer appointments. She had her turn as health minister, and frankly, it's not a great legacy.
Question number 3. Order. Order. Point of order.
I waited until the end of Annie King's question. I'm sorry that I wasn't quite quick enough in raising the point of order at the end of the Minister of Education's contribution, where she sought leave to table a document. My understanding is that ministers, if they wish to table documents, don't actually need leave. So if there was objection, in fact, a minister can still table a document without seeking the leave.
Well, that's certainly news to me. I think all members are required to seek leave of the House if they wish to table a document. I'm not aware that a minister is treated in any different way to a member of Parliament in that case. The leave was put. It was denied. Question. Supplementary question, Barbara Stewart.
Thank you, Mr. Speaker. Can the Minister confirm that the real reason his government has failed to fund a national bowel cancer screening program is because government health expenditure is insufficient, and that he would prefer to save money rather than lives?
The Honourable Dr Jonathan Coleman.
That's totally incorrect and emotive. That member knows we've got a $24 million screening program. We put another $12 million in at the election. We've spent another $11 million plus on endoscopies, and we're taking the business case to Cabinet later this year. So that's totally false and mischievous.
Question number 3.